Good morning. Welcome to our Survivorship Conference here at the University of Minnesota. I'm thrilled to be here today, not only for myself, but with our team that you'll hear from throughout the day, but also with one of our patients, Judith Gerke. I want to welcome you to this is our 15th annual Survivorship Conference, and we're thrilled to have you here today. For those of you who don't know me, my name is Ann Blaze. I'm one of the medical oncologists here at the University of Minnesota, and I help direct our adult long-term follow-up clinic for cancer survivors. I work as part of a team, some that you'll see throughout the day today, including Kareem Sadak, who works with our pediatric group, and Jill Lee, as well as Shernan Holton with our BMT program. We're thrilled to have you. I hope you find today enjoyable. I hope you learn a lot and get to reflect on where you've come in your cancer journey, as well as learn some new things about how to stay well after having a cancer diagnosis. As I mentioned to you, this is our 15th annual Survivorship Conference. This year looks a little different. We're all virtual. So bear with us. As you might have noticed, even our agenda, talking to Judith, we've modified slightly. So I thank you for working with us as we put on this virtual event this year. We hope next year we'll be back in person. For all of you that have had a cancer diagnosis, I don't need to tell you that, one, there's a rising number of cancer survivors, now to over 15 million in the US. But as all of you know, for those of you living with cancer or cured from your cancer, many people go through different complications after their cancer treatment, whether that's fatigue, changes in quality of life, cardiovascular complications, worry about financial implications, or other diseases such as neuropathy or cardiovascular disease. So throughout the day today, welcome, and I hope you learned some things about how to stay well. And I hope your family is joining you today as well to hear about some of these things. We thought we would start this year by talking with one of our patients who's gotten a lot of care here at the University of Minnesota. The patient perspective is really important for us as providers. That's where we learn about new things we need to be doing research on, as well as how to improve our care. So I want to introduce Judith Gerke. And Judith, maybe you can tell us a little bit, welcome and thank you for being here.
Thank you.
And I'm wondering if you can start off by telling us a little bit about yourself and sort of where your cancer journey started.
Certainly. Judith Gerke. I'm an alum of the University of Minnesota. It was my undergraduate. But the wonderful thing about that is, there's many, I should say, is that it led me to the University of Minnesota Healthcare Center to really start my regiment of my journey of cancer, unfortunately, which has been long, but very successful. And I contribute that a lot to the wonderful care I received at the university, being a big research institution. When we talk about where did my journey start, I'm going to say 30 years old, just delivered my first child, and 1 month later, my OBGYN discovered a lump, and that was here at the University of Minnesota. Well, I was referred and got excellent care. At that time, it was a Dr. Lee. She had a 40-60 chance of survivorship that she presented with her radiation for Hodgkin's at the time. And she was one of the highest cure rates for that particular disease at that time in the nation. So there was a very fortunate turn right off the bat. I went through the treatment. I was put in remission, and I never looked back on that particular disease. The confidence that the research and the background that Dr. Lee gave me told me I could sit and worry about this for a long time, but I'm not going to worry about a little percentage, especially because I was in remission. So fast track, many years later, I developed breast cancer. And once again, I was referred here to the University of Minnesota by my practitioner, who definitely practiced here and met with Dr. Blaze. And when she told me of the wonderful innovations that they have done, I pretty much put my faith in her hands and probably all of the resources we could use here at the U, and started the process. Presently, I am terminal, but I am living with cancer. So I don't look at every day as, oh, gee, poor me. I look at it as, well, here's a great opportunity. What should I do today? What should I plan for the week? How should I plan my year? And how about the future? And that's about what I've been doing. And I can say that that's about my cancer experiences. A lot of confidence here in these research doctors.
Thanks for sharing that, Judith. I think you didn't tell people you were a student athlete when you were here at the university, multiple faceted. But I think, it'd be helpful for us to hear a little bit about what, as far as going through all of your treatments, now going through 2 different cancers, what kind of complications and things have you noticed as you've gone through your treatment?
Well, my first one was very interesting because radiation was very primitive at the time. And so I was amazingly tired. I had to have my mother really do the heavy lifting with my son and myself to get me to treatments. And now radiation is that's all minimal as far as how tired you become and how you lose your appetite and things of that sort. My next experience with breast cancer, which started a couple years ago, that was different because that was chemo. I did not have chemo with my first, but of course, the new drugs that they have with regards to your appetite, with regards to your nausea, things of that sort, are really quite successful as far as how they treated me. Probably the biggest effort was that I really had to get a plan down. Not only did my team here at the U, Dr. Blaze, etc., had a plan, but I had a plan of how I was going to go through this at an older age, not quite so spry, etc. And I really started with looking back at those days of competition. What's my skill set to make it through this? And of course, 3 sports at the university, definitely discipline. But I look at it for other people that didn't have that opportunity. You've got a lot of discipline in your life. Whether you were a mother and you had to get up with that ill infant or get up every night for feeding, you just pushed through. And so I look at it as my skill set, but I think you should look at it as your skill set. When you think that you just don't maybe have it, look in your life, whether it was the meeting you just dreaded and got through, or the meeting you really took a lot of notice on, had to take a lot of notes and present. We have those skills, and I encourage all of you to look at yours and get you through, once again, the day, the week, and the year and the future of how you're going to live with this cancer or how you're going to beat it and put it in recession.
Thanks for sharing that. I think your perspective is really helpful and useful for all of us. I know this year's had a lot of challenge for many people, and so being reminded of, should we say, digging deep and finding that strength is really helpful. I know as you've gone through this, you've also experienced some ways that your cancer treatments affected your heart. And I'm wondering if you can tell us a little bit about that.
Well, that's interesting. The radiation from my Hodgkin's affected my heart in the way that it deteriorated the valves. And with so many years of research now, they know a lot more about getting on top of that. And that's pretty much what my Ann Blaze worked with her survivorship program, where she interacts with the rest of the team that care for me for different diseases, and interacted with Dr. Canetti, my cardiology doctor, and they determined the best sort of treatment that I could use for my cancer that would be less effective on my heart. But nevertheless, Dr. Canetti referred me to the Mayo when they discovered that the valves were quite deteriorated. So I had both valves affected. One they have some wonderful fixes for, as far as mechanical, which I'm sure you're quite familiar with. You can do a big valve, you can do a mechanical valve. The other, the aorta, they haven't been successful in that yet. But in referring me to Mayo, they had given me another opportunity to not only have the one fixed, but also the other fixed, where eventually, had I not had that fixed, I probably would have died from that heart disease, where things would have just collapsed. And so the experiment that I was in, or I should say the research that I was in at the Mayo, took a normal replacement valve that was not made for the other valve and maneuvered it into that valve position. That in turn allowed me to have both valves replaced. I did run into a little complication where there was a tear, which is kind of interesting, and it put me in a life-threatening position, but my team went back in and did a unique repair, one that had never been done, to make certain that that valve was in there and that it was working functionally. So what they know now, I think that the new patients will be observed a lot sooner. And I do know that Dr. Blaze is taking a look at all of my routine. One was that my kidney shut down with that heart valve. And so now she coordinates with the cardiologist here at the U, the cardiologist at the Mayo, the kidney doctor that miraculously got me off of dialysis. And she also coordinates with, there's one other.
Infectious disease.
Because I did have a life-threatening infectious disease after all of these procedures. So I feel quite confident that when you know you've got a research team that takes a look at everything and is very comprehensive, you are definitely going to be in great hands to have the best outcome.
Thanks for sharing that. And it sounds like you've had a lot of care coordination as part of your care, going through not just one cancer, but two cancers, and then infections and cardiovascular complications. When you look back on it yourself, are there things that you or your family wish that you had known about ahead of time when it came to sort of long-term risks? Or are there things you wish your healthcare team had sort of shared from their perspective?
Yes, that is a lot of the, if I may say, a lot of the patient's responsibility of how you take on your care. And I was fortunate enough to have all this coordination, which I know not everyone does. So as far as what I wish maybe I knew more of, I wish that the advancement of cancer treatment was as far successful back then as it is now, which gives all of you the opportunity to really share the many, many things, whether it's diet, whether it's exercise, the specifics that they do know that's coordinated either to cancer in general or to your cancer specifically, I think is a big part of what I wish back then and what I know now. I guess I want to just reiterate or really emphasize that the journey of surviving cancer for me is definitely things that I had mentioned. Take your skill group, use your caretakers, rely on your physicians, take that information and study it. Study the different areas that you're going to learn today in this conference, but probably how I start my day every day. Admiral McRaven had a famous saying, make your bed. That's how you should start your day. So I definitely get up, I do my routine. When I'm just too tired to follow my routine, I can maybe take a look at giving myself a little reward. I dig a little deeper. I call my caretakers and just ask, I'm stumbling with this. I'm really falling down a little bit. I'm not feeling good today. Well, pretty soon, when you dig deep, you just keep going. One foot in front of the other, and you just keep maneuvering until, in my opinion, you get a pretty good sturdy routine, and you go from there. The other thing is that in all of this, the most grateful thing I can say is that I'm so grateful for the research that has been done at the University of Minnesota and all of the other research institutions. I definitely am proud to say that I give to the cancer research institutions, and I find out different ways of supporting them, because had some of these things been known 20 years ago, how many more of us would be just simply living with cancer rather than not having that opportunity? I thank you so much today.
Thank you, Judith. I appreciate you being here with us today, and I'm going to have to remember to make sure I make my bed each day. I try to remind my kids that, but I have to remember that myself. That's really helpful. And I think today, part of our survivorship conference, it's a lot of the different breakout sessions that are here are focused on lifestyle and nutrition, and some about inflammation aging and how does cancer affect some of the aging process. So I hope that you and our participants will be able to hear a little bit more about that. I think sometimes as providers, we forget that care coordination is not just with other doctors and the patient and the nursing group that's working with you, but it's also our team. It's our cancer rehabilitation team. It's our nutrition team. It's getting you back functioning and active. So thanks for sharing your time today, Judith. I really appreciate it. And I know our audience will too.
Thank you. It's an honor to be here.
I have the distinct pleasure of introducing Dr. Dan Mulrooney. Dan is a faculty member and an associate member of the Division of Cancer Survivorship at St. Jude Children's Research Center. He's also the deputy director of the After Completion Therapy Clinic at St. Jude. Dan Mulrooney was one of our faculty members here at the University of Minnesota for a number of years. He helped to organize actually our very first survivorship conference, and we're thrilled to have him return 15 years later to talk about where has research gone for cancer survivors between the past, the present, and as we think about the future moving forward. I'm thrilled to have Dan here. Welcome.
Good morning. I'm Dr. Dan Mulrooney from St. Jude Children's Research Hospital, and I want to thank you for the opportunity to be able to present at your conference today. I'm very honored to have been invited, and I'd like to present on cancer survivorship, past, present, and future. The University of Minnesota Cancer Survivorship Conference began initially in 2005. And now, in its 16th year, I thought this would be the perfect opportunity to review the progress in cancer survivorship since that first conference in 2005, discuss the impacts this progress has had on survivorship care, and examine future challenges for cancer survivorship. I have to tell you that in the fall of 2019, Dr. Sadak and Blaze kindly invited me to present at this conference. Having been involved with the beginning of this annual conference in 2005, they offered me the opportunity to attend for the 15th anniversary of this event. I was honored to be asked, and of course I jumped at the chance to return to the University of Minnesota and attend this conference. I didn't want to miss this opportunity to be with you again, and really nothing could keep me away. Of course, what could possibly go wrong? Well, let's just say missing the 15th year was difficult for all of us, and how grateful I am to be here with you for the 16th Annual Survivorship Conference. The missed opportunity of the last year made me realize that in 2021, we are now celebrating the 50th anniversary of the National Cancer Act, signed into law on December 23, 1971, by then President Richard Nixon. This law was specifically designed to strengthen the National Cancer Institute, the NCI, to more effectively carry out the national effort against cancer. The president at that time coined the term war on cancer, which has become part of our lexicon ever since. The goals of this act were to increase cancer research, develop more effective cancer therapies, and reduce cancer as a major cause of death. And since that time, many have debated whether or not we have won the war on cancer. Depending on your perspective, you may have differing opinions on this. However, just to note that when the act was signed, there were approximately 3 million cancer survivors alive in the United States. That number grew to 12 million in 2007, 15 million in 2016, and over 17 million today. And it is projected to reach 26 million by the year 2040. Note that the majority of these cancer survivors are over 65 years old. Well, let's fast forward from 1971 to 1986, when a group of cancer survivors realized the need for advocacy for cancer survivorship, and they began the National Coalition for Cancer Survivorship. This nonprofit organization was the first to change the terminology from cancer victim to cancer survivor. This really began to change the perspective on cancer survivorship and the long-term needs of this growing population. Their goal is to influence government agencies and policymakers. Fast forward further to the new century, and things really began to change with two seminal publications from the Institute of Medicine. First, in 2003, Childhood Cancer Survivorship, followed in 2005 by a publication entitled From Cancer Patient to Cancer Survivor, Lost in Transition. This second report in 2005 outlined 10 recommendations for improved cancer survivorship care. And these included raising awareness of cancer survivorship, the development of survivorship care plans, promoting the development of surveillance guidelines for cancer survivors, promoting quality of cancer survivorship care, testing models of survivorship care, and advocacy for state cancer control plans. And in fact, today, all 50 states have a cancer control plan, and most of these are 5-year plans. But one should note that in the state of Minnesota, there is currently a 10-year plan, which is extending until 2025. Additionally, this increased provider education around cancer survivorship, and the goal was to eliminate discrimination for cancer survivors, not only based on race or gender, but also employment and insurance-related issues for those who have cancer or are a cancer survivor. And the final goal was the promotion of cancer survivorship research, so we can better understand the risks for late effects and the important needs of this growing population. Other organizations and medical societies have subsequently endorsed and promoted cancer survivorship as well. In 2011, the American Society of Clinical Oncology developed several survivorship-related initiatives, including the development of a survivorship committee, which is currently chaired by Dr. Ann Blaze, the development of a patient survivor care tract at the Society's annual meeting, and the promotion of guidelines for survivorship care. In the same year, the Live Strong Foundation convened a meeting on the essential elements of survivorship care. an effort to engage community leaders, stakeholders, cancer survivors, and cancer advocates on the goal of developing best practices to address the needs of cancer survivors. And this group aimed to reach consensus on the essential elements of survivorship care delivery. The following year, in 2012, the American College of Surgeons Commission on Cancer added patient-centered care to their guidelines for accreditation from their organization. They particularly focused on navigation of cancer care, distress screening, and long-term follow-up care. This promoted the further development of survivorship care plans for all patients completing cancer therapy. And recognizing some of the challenges on cancer centers to comply with these guidelines, the Commission went back and updated these recommendations in 2020. And in 2018, the National Academy of Medicine, which was formerly the Institute of Medicine, published proceedings from a follow-up to their previous publication, Lost in Transition, to highlight ongoing efforts to improve planning, management, and delivery of survivorship care. This publication is entitled Long-Term Survivorship Care After Cancer Treatment. This advocacy has really led to the promotion of survivorship programs in most cancer centers across the country. Programs may differ depending on location, but depending on the particular cancer center or the needs of the cancer population in that particular area. But they largely, most of the components include access to survivorship experts, awareness of emerging research, health concerns, and recommended follow-up care. They are often multidisciplinary, and they help survivors obtain and understand personal survivorship care plans, which should generally include diagnostic information, cumulative treatment exposures, major clinical events, transfusion history, family history, and cancer-related health risks, screening recommendations, and health behaviors that may modify cancer risks. As you may know, there are differing models of cancer survivorship care. And these include academic models, which may follow survivors longitudinally, or they may act in a consultative role in conjunction with an individual survivor's primary care provider. Community practice models, or shared care models between academic community practice and a primary care provider. Differing models work best for different groups of survivors and in different communities. This mandate to develop survivorship care plans has developed over time, and these plans may take many different forms. On the right is just an example of what we have chosen to include in our survivorship care plans here at St. Jude. And this includes diagnostic information, cumulative treatment exposures, important clinical events during and after therapy, the transfusion history, family history, and cancer-related health risks. Information about modifying health behaviors and risks. And this is all followed by suggestions for screening tailored to the risk of the individual survivor. It's important to recognize, however, there are many challenges to implementing survivorship care. And these can be provider, patient, or system-based or financial constraints. Providers are not always familiar with or comfortable managing the unique health issues related to cancer therapy. And unfortunately, access to needed specialty care may be limited. Similarly, patients may not have all the knowledge they need regarding recommended follow-up care. Understandably, many may be anxious about future health issues or struggle with healthcare access. Standardized guidance is improving, but there are still some gaps in knowledge and formal recommendations. as well as challenges with adequate insurance coverage and or appropriate support and access to medical care. The financial toxicity of cancer survivorship is an important area of research, which will hopefully lead to improvements in insurance coverage, which is often employer-based. The Affordable Care Act has been a helpful support to many cancer survivors. So, what does the future hold for this population that continues to grow? Research has taught us a lot about current cancer treatments and led to much of the success we now realize. However, many patients still endure relapses of their cancer or are diagnosed with cancers that may be refractory to current therapies. Fortunately, in a large part due to what we've learned from cancer survivors, many new therapies are emerging with the goal of successful cancer treatment while minimizing the effects upon the normal tissues. You may have heard of or even been treated with some of these new molecularly targeted therapies, which include tyrosine kinase inhibitors, immune checkpoint inhibitors, monoclonal antibodies, chimeric antigen receptor T cells or CAR T cell therapy, or mTOR inhibitors, just to name a few. These therapies may be used alone, as in monotherapy, or in combination with other chemotherapy agents. As more patients are treated with these new therapies, we will learn more about the long-term health effects related to these new agents. And new therapies are not restricted just to chemotherapy, but also include new modalities and methods to deliver radiation therapy, such as dose reductions, conformal radiation techniques, intensity modulated radiation, stereotactic body radiation, and proton beam radiation. And in fact, many of these therapies are currently under investigation there at the University of Minnesota. And of course, new surgical procedures have the potential to change long-term effects of cancer therapy as well, with minimally invasive therapies and limb salvage techniques, just to name a few. Additional research will lead to improved understanding of these new approaches to treating cancer. We will need time to understand these outcomes, and informative publications really have yet to be published. However, in 2019, the Association of Community Cancer Centers released a publication for survivorship care plans for patients receiving immunotherapy. So the data are just now beginning to emerge. The world of precision medicine is just beginning to take shape. And in President Obama's 2015 State of the Union address, he announced the creation of the Precision Medicine Initiative. And this was to bring us closer to curing diseases like cancer and diabetes, and to give all of us access to the personalized information we need to keep ourselves and our families healthier. And perhaps this will lead to precision survivorship as well. This is just an example of some of the genetic work that has been done to investigate why some survivors experience cardiotoxicity while others may not, despite receiving very similar therapies. Understanding the genetic makeup of an individual may lead to improved prediction of outcomes for that person and improve the understanding of that individual's unique treatment risks and guide future screening for that particular individual. Increasingly and importantly, survivorship care has become a subspecialty of oncology. In the future, we may see it become even further specialized. Our understanding of the genome will hopefully lead to more targeted therapies with or without off-target effects. What we have learned about late cardiovascular effects of cancer therapies has led to the recognition of the important relationship between oncologists and cardiologists and spawned a new subspecialty in cardio-oncology. And furthermore, the amount of data generated from imaging studies, laboratory studies, and these genetic studies is increasingly large. There may be opportunities in the future to learn from these very large data sets by applying computer algorithms and models known as machine learning. They may help us further understand which survivors are at risk for particular late effects and thus allow us to better provide screening, health counseling, and services to individual survivors. So back to the present. The past has taught us much, and the future holds many possibilities. But I would be remiss not to end with what can we do today to maintain or improve our health and perhaps prevent cancer in the first place. We've known for many years that certain behaviors can increase the risk for cancer. Use of tobacco causes cancer. Alcohol in excess can damage our health. Physical activity is not only safe for cancer survivors, but can preserve and improve health. We now have immunizations that not only prevent disease and infection, but can prevent cancer. And all should be immunized for hepatitis B and the human papillomavirus. Unfortunately, many of these measures have suffered during the pandemic, so we may need to reinforce our efforts on cancer prevention. And finally, many organizations have developed information and resources for cancer survivors related to the COVID-19 pandemic. And on this slide, I have listed several here for you, and you may find, hopefully, their websites to be helpful. Again, I am so pleased to have been invited to participate in this annual conference, and I thank you for your time, and I'm very happy to take any questions. Thank you.